Hi, I'm Caden, and today I will be talking about cystic fibrosis. Let's first understand what cystic fibrosis is. Cystic fibrosis is a genetic disorder which affects the lungs, pancreas, and other organs. Cystic fibrosis is progressive, which means that the disease worsens over time. 40,000 people have cystic fibrosis in the United States, and roughly 105,000 people across 94 different countries. Cystic fibrosis causes thick and sticky mucus in the lungs, which makes breathing for a person with cystic fibrosis more difficult. The airways of the lungs of a person with cystic fibrosis is thinner compared to a normal person's airway, so less air gets in. Also, germs may be trapped inside a person's lung if they are infected with cystic fibrosis. In the liver, the thick mucus can block the bile duct, which can cause liver disease. In the pancreas, the thick mucus prevents the release of digestive enzymes, which can lead to malnourishment. Also in the pancreas, the thick secretions can lead to damage in the pancreas and minimal enzyme secretion. Cystic fibrosis is considered a recessive gene, which means that a person must inherit two recessive alleles of the cystic fibrosis protein in order to have cystic fibrosis. This also means that both parents must either have cystic fibrosis themselves or be a carrier of cystic fibrosis if they do not have it. Symptoms of cystic fibrosis include shortness of breath, wheezing, chronic sinus infections, persistent coughing, sometimes with mucus, very salty tasting skin, frequent lung infections, and other symptoms. Let's now talk about the system transduction pathway of cystic fibrosis. In the pathway, the ligand is a calcitonin gene-related peptide ligand, and the GTP activates other messengers. The receptor is an intracellular receptor, which means that the binding of a ligand to the receptor happens inside the cell. The transduction is shown in the image. The protein kinase A, or pKa, sends a signal to open up the chloride channel, or the cystic fibrosis transmembrane conductance regulator, CFTR protein, and that is the response from the cell to the ligand attaching to the receptor. Chloride is typically a part of a salt, which is typically bonded with sodium ions, potassium ions, and other positively charged ions. The correct mechanism would have the GTP activating adenylyl cyclase, converting ATP into cAMP. This activates the protein kinase A, which sends a signal to the CFTR protein. ATP is binded to the CFTR protein, which opens up the CFTR protein. This allows chloride ions to go through the channel protein and exit the cell. However, in the faulty mechanism, there will be a mutation in the CFTR genes. This means that the CFTR protein will have a slightly different amino acid sequence compared to the correct mechanism, and therefore the CFTR protein does not work as planned. The CFTR protein does not open up or does not open up completely, and the chloride stays trapped inside the cell. Through equilibrium, water stays inside the cell as the concentration of chloride inside the cell is higher than the concentration of chloride outside the cell relative to a normal person's concentrations. The mucus on the outside will be really sticky and thick. As a result, due to the stickiness and thickness of the mucus, the cilia around it cannot wash away germs and bacteria, which can potentially lead to infections as well. Potential other results also include respiratory failure and inflammation, among other complications. These are the results of cystic fibrosis. These are the references I used for researching about cystic fibrosis. Thank you.